Method of preparation. First method spray drying. Second method solvent evaporation. Third method single emulsion technique. Fourth method double emulsion technique. Fifth method phase separation coacervation technique. Sixth method spray drying and spray congealing method. Seventh method solvent extraction. Eighth method quasi emulsion solvent diffusion. In ninth method polymerization techniques. First method spray drying. In spray drying technique, the polymer is first dissolved in a suitable volatile organic solvent such as dichloromethane, acetone, etc. The drug in the solid form is then dispersed in the polymer solution with high speed homogenization. This dispersion is then atomized in a stream of hot air. The atomization leads to the formation of the small droplets or the fine mist from which the solvent evaporates instantaneously, leading the formation of the microspheres in a size range 1 to 100 micrometer. Microparticles are separated from the hot air by means of the cyclone separator, while the trace of solvent is removed by vacuum drying. One of the major advantages of this process is feasibility of operation under aseptic conditions. Second method, solvent evaporation. This process is carried out in a liquid manufacturing vehicle phase. The microcapsule coating is dispersed in a volatile solvent which is immiscible with the liquid manufacturing vehicle phase. A core material to be microencapsulated is dissolved or dispersed in the coating polymer solution. With agitation, the core material mixture is dispersed in the liquid manufacturing vehicle phase to obtain the appropriate size microcapsule. The mixture is then heated if necessary to evaporate the solvent, for the polymer of the core material is dispersed in the polymer solution. Polymer shrinks around the core. If the core material is dissolved in the coating polymer solution, matrix type microcapsules are formed. The core materials may be either water soluble or water insoluble materials. Solvent evaporation involves the formation of an emulsion between polymer solution and an immiscible continuous phase, whether aqueous or non-aqueous. Third method, single emulsion technique. The microparticulate carriers of natural polymers, it means those of proteins and carbohydrates, are prepared by single emulsion technique. The natural polymers are dissolved or dispersed in aqueous medium, followed by dispersion in non-aqueous medium like oil. In the next step, the cross-linking of the dispersed globule is carried out. The cross-linking can be achieved either by means of heat or by using the chemical cross-linkers. The chemical cross-linking agents used are glutaraldehyde, formaldehyde, acid chlorides, etc. Heat denaturation is not suitable for thermolabile substance. Chemical cross-linking suffers the disadvantages of excessive exposure of active ingredient to chemicals if added at the time of preparation and then subjected to centrifugation, washing and separation. The nature of the surfactants used to stabilize the emulsion phases can greatly influence the size distribution, surface morphology, loading, drug release and bioperformance of the finer multiparticulate product. Fourth method, double emulsion technique. Double emulsion method of microspheres preparation involves the formation of the multiple emulsions or the double emulsion of type water in oil in water and is best suited for water soluble drugs, peptides, proteins and the vaccines. This method can be used with both the natural as well as synthetic polymers. The aqueous protein solution is dispersed in a lipophilic organic continuous phase. This protein solution may contain the active constituents. The continuous phase is generally consist of the polymer solution that eventually encapsulates of the protein contained in dispersed aqueous phase. The primary emulsion is subjected then to the homogenization or the sonication before adding to the aqueous solution of the PVA. The results in the formation of a double emulsion. The emulsion is then subjected to solvent removal either by solvent evaporation or by solvent extraction. A number of hydrophilic drugs like LHRA agonists, vaccines, proteins or peptides and conventional molecules are successfully incorporated into the microspheres using the method of double emulsion, solvent evaporation or extraction. Fifth method, phase separation coacervation technique. This process is based on the principle of decreasing the solubility of the polymer in organic phase to affect the formation of polymer-rich phase called the coacervates. In this method, the drug particles are dispersed in a solution of the polymer and an incompatible polymer is added to the system which makes first polymer to phase separate and engulf the drug particles. Addition of non-solvents result in the solidification of polymer. PLA microspheres has been prepared by this method by using butadiene as incompatible polymer. The process variables are very important since the rate of achieving the coacervates determines the distribution of polymer film, the particle size and agglomeration of the formed particles. The agglomeration must be avoided by stirring the suspension using a suitable speed stirrer since as the process of microspheres formation begins the formed polymerized globules start to stick and form the agglomerates. Therefore, the process variables are critical as they control the kinetic of the formed particles since there is no defined state of equilibrium attainment. Spray drying and spray congealing technique. Solvent extraction method. Solvent evaporation method is used for manufacturing of microparticles, involves removal of the organic phase by extraction of the non-aqueous solvent. This method involves water miscible organic solvents as isopropanol. Organic phase can be removed by extraction with water. This process decreases the hardening time for the microspheres. One variation of the process involves direct incorporation of the drug or protein to polymer organic solution. Rate of solvent removal by extraction method depends on the temperature of water, ratio of emulsion, volume to the water and solubility profile of polymer. Quasi-emulsion solvent diffusion. A novel quasi-emulsion solvent diffusion method to manufacture the control-release microspheres of drugs with acrylic polymers has been reported in the literature. Microsponges can be manufactured by a quasi-emulsion solvent diffusion method using an external phase containing distilled water and polyvinyl alcohol. The internal phase consists of drug, ethanol and polymer.
The concentration of polymer is in order to enhance plasticity. At first, the internal phase is manufactured at 60 degrees centigrade and then added to the external phase at room temperature. After emulsification process, the mixture is continuously stirred for 2 hours. Then the mixture can be filtered to separate the microsponges. The product is then washed and dried by vacuum oven at 40 degrees centigrade for a day.
Polymerization techniques. The polymerization techniques conventionally used for preparing the microspheres are mainly classified as normal and interfacial, and both are carried out in liquid phase. Evaluation parameters of microspheres. Application of microspheres in pharmaceutical industry.